Good afternoon, everyone, and thank you for being here today. Thank the organizers for the invitation and opportunity to participate in your meeting. So, the signals about what human activities have done to the environment are becoming increasingly shrill. The figure shows the increase of the global temperature, and each decade in the latest 50 years is hotter than previous one, and conclude that more than half of the observed increase in global average temperature was caused by elevated emission of carbon dioxide and other greenhouse gas by human. We have already reached 1.2 global warming, and to limit warming to 1.5 degrees Celsius, which is the target of the Paris Climate Agreement, emissions need to drop by 45% by 2030, or to decrease fossil fuels production by roughly 6% every year between now and 2030. And countries are in state projection an average annual increase of 2%, which by 2030 would result in more than double the production consists with 1.5 degrees limit. So the government collective climate commitment need to be more ambitious. That's why the climate change is resulting in poor health outcomes, in increasing mortality, and it's a driver of health inequities. So climate change affects our health and well-being in many ways, with both direct physical impacts and flow-on social and economic changes. The extreme weather events pose a serious risk to the most vulnerable, such as the elderly, infants, people with chronic health condition, outdoor workers. And the health impacts include total mortality, cardiovascular mortality and morbidity, also respiratory mortality and morbidity, and definitely the mental health. So there are some direct risks to health, like heat waves, which drives the excess deaths, or extreme cold, which drives cardiovascular and respiratory diseases. Or floods create risk of drawing and damage homes with impacts of mental health. So that's why the disaster related to weather, climate occur every day. And on average, over the 50 years, they killed around 115 people daily, or causing $202 million losses also daily, according to the comprehensive new report from the World Meteorological Organization. But the number of extreme weather events has increased by a factor of 5 over the 50 years period, which is driven by climate change. And unfortunately, there are no good news for the future. Climate change is projected to significantly worsen the current situation. And not only the climate change, but also Europe is still becoming more urban, population is aging, and the prevalence of chronic and not communicable diseases is rising. So, for example, in our European WHO region, around less than 2,000 recorded disaster accumulated, with 160,000 deaths in the last 50 years. But although the floods and storms were the most prevalent cause in the recording disaster, the extreme weather temperature accounted for the highest number of deaths, with 93%. We are fully aware that there are positive association between extreme heat or cold events and overall cardiovascular and respiratory mortality, because it was reported in most studies, including the latest IPCC report. Also, wildfires are likely to increase the overall cardiovascularity mortality, and floods may be associated with deterioration of mental health instead of mortality. But also other factors like allergies is very important, because the new evidence from the 6th IPC report of the vulnerability suggests that the burden of allergic diseases, particularly allergic rhinitis and allergic asthma, may be change in response to climate change, showing an increase in the land pollen session attributable to climate change. And this is the expectation that 77 million projected to be increase the number of people who are affected by ambrosia between 2041 and 2060. We should remember that the projected health consequences depend greatly on the rate of which ambrosia spread. Therefore, control measures against the invasion of these plant species may be an important adaptation strategy in response to climate change. And we are fully aware that over 7 million people a year die from exposure to air pollution. It's our top environmental risk factor to deaths. It is one of 8 of all deaths, and over 90% of the people breathe outdoor air with pollution level which exceed WHO air quality guideline values. And 2/3 of this exposure to outdoor pollution result from the burning of the same fossil fuels that have driven climate change. So this is the synergy. So tackling climate change, you tackle air pollution and vice versa. This is about the risks, but also WHO since many years, and our region since 30 years ago, works in 3 key focus areas to advance climate resilience health. The first is addressing the wide range of health impacts of climate change. The second is strengthening the climate resilience and environmental sustainability of health system and facilities. And the third is promoting the health benefits of climate change mitigation in other sector. So there are many international activities to tackle climate change, and the original UN Framework Convention on Climate Change from 1992 sees the protection of human health and well-being, along with the natural environment and socio-economic system, as the core justification for international climate action. Because this Paris Agreement from 2015 refers to right to health. Even in the first page, it is very important because the Paris Agreement commits countries to limit warming. That is essential to safeguard the environment and social condition for health. It asks countries to make commitment how much they will cut greenhouse gas emission, and commits climate finance. This is all very important. But also 2021 and the COP26 was an anchor of implementation of the Paris Agreement. So there were very big expectations from Glasgow, because it is this conference which held last year in November was a deadline for the Paris Agreement to be operationalized, after which all implementation guidelines of the Paris rule book need to be in place. And COP was instrumental to agree on the evidence-based pathway to zero carbon state and to build a resilient and inclusive and green global economy. The outcome of the COP26 was the Glasgow Climate Pact. Even it doesn't fulfill all expectations from the country, but it calls all parties of this convention, 197 countries, to report their progress towards small climate ambition for this year, for COP27, which will set to take place in Egypt in November this year. And it was very important, this Glasgow pact, because it called on countries to revise and strengthen their target by end of this year to align them with the Paris Agreement temperature goals. It also asked countries that have not yet done so to submit the strong national determined contribution, long-term strategies, and help align the net zero and 2030 target and ramping up the ambition. So also the COP26 decisions say that countries resolve the pursue efforts to limit the temperature increase to 1.5 degrees. So in line with this commitment, WHO support countries and for the first time in the history of COPs, health has a very prominent role. So before the COP, WHO published its manifesto for healthy recovery from COVID-19 with 6 prescriptions for healthy and green recovery. But also before the COP, the 10 recommendations in the special report on climate change and health propose a set of priority action from the global health community to governments and policy makers, calling on them to act with urgency on the current climate and health crisis. Because all these recommendations were developed in consultation with over 150 organizations, 400 experts, and millions and millions of health professionals. So in general, when we are talking about climate change and what is the role of the health sector, there are 3 main tasks for public health. Because the health sector needs to adapt and become resilient to climate change and protect health from full range of rising climate risks, like extreme weather even, for example, or infectious diseases. The second is to reduce greenhouse gas emissions from its operations, contributing to mitigation efforts, because the facilities can reduce fossil energy use via green building. And the third is help reduce carbon emission from promoting health, like air pollution, but reduce fossil energy from material manufacture and transport. If this were global task, we are also focused on more European-wide. WHO European Office and our environmental center, our European Center on Environment and Health in Bonn, help reduce carbon emission to promote health. We publish several tools, and definitely I assume that Dorota will speak more about the WHO Global Air Quality Guidelines, because she leads the whole process at the global level. Then we also address health adaptation to climate change. We published recently the heat evidence on impact of the heat waves on the health, and also we also support countries to manage health risk due to flooding. And definitely one big area of the work is how to make the health system more sustainable. So we have as a WHO global and regional processes. The global is our WHO Global Strategy on Health, Environment and Climate Change from 2019. But we have very specific flow of activities and mandates, specific one for our region, which come from the European Environment and Health process. We have our working group on health and climate change, a political working group since 2012 of nominated representatives from both environment and health sectors, which support countries to facilitate their communication and share and bridge the gaps between different parts of the region, because we have the specificity of having this environment health process with our ministerial conference, which started more than 30 years ago in Frankfurt, where for the first time the climate change was recognized as a health issue. And then gradually, we have other conferences like London, Budapest, Parma, and Ostrava, and our next ministerial conference will be held in Budapest next July. So also one very important issue is that we have specific European-wide consultation process of our working group, which after consultation with a lot of our partners like European Commission, other UN partners, other key stakeholders, and also the social, the NGOs, we think that we develop our zero regret papers, which serve as role models across the region, which support the formulation of key health messages for the regional committee first originally, but they fit with COP26 and towards the next ministerial conference, because we try to scaling up action on climate change mitigation and adaptation for health in the whole WHO region, and it is aimed at policymakers, particularly from the health sector and civil society representatives, with the intent to raise awareness about the link between health and climate change, but also about the policy options that can maximize the benefits of health and environment. So we know that definitely climate change is a public health crisis, which calling for the transformative efforts. We have another windows and opportunity to call for urgent action at scale, but we need to call the health-oriented action and sizing opportunities for local and national climate action. So your meeting here there in Poland should be one kind of synergized activities in the local and the national level, and because we try to optimize the climate resilience and sustainability within health system by scaling up adaptation action and climate-proof within health protection, promotion, and improvement programs. We should lead by example and proactively promote and strive for green, low-carbon health service delivery as soon as feasible, but preferably by 2050. I will finish with this because I just would like to highlight that the windows of opportunity is narrow and our urgent action is needed and scale. So we need to support health sector to become a partner and high level in national climate change policy making and programming. We also would like to encourage development of vulnerability and adaptation assessment and health national adaptation plan and promote heat health action planning. So promote climate adaptation and climate resilience of the health sector needs to link national climate mitigation and air pollution agenda. So we need to go hand in hand with all this effort. Thank you very much, and once again, I wish you a good meeting. Thank you.